In this video, we will be talking about hypertension again, but these questions will be specifically directed towards medication. There will be 5 questions. I will read the question to you, then I'll pause for a second to see if you can come up with something that you remember. Then I will read the 4 options and we'll go over why the answer is best. If you need more information on these topics, you can find it usually in the cardiac sections or the vascular section of your nursing resources. So let's get started. Number 1. While discussing her diagnosis of hypertension, a client asked the nurse how long she's going to have to take all of the medications that have been prescribed. On what principle is the nurse's best response? Is the answer number 1, the client will be scheduled for an appointment in 2 months and the doctor will decrease her medications at that time. Number 2, as soon as her blood pressure returns to normal levels, the client will be able to stop taking her medications. Number 3, to maintain stable control of her blood pressure, the client will have to continue taking medication. Number 4, the nurse cannot discuss the medication with the client will need to talk to the doctor. And the answer here is number 3. And so in the question, she is asking how long she has to take all the medication. And with this blood pressure issue, as well as with a lot of disease conditions, it's the medication that's making them better. So the thought is that the medication is keeping the client from the hypertension and needs to continue. And that's why number 3 was the answer. So in the further learning at the bottom of the slide, remember that medications do need to continue unless somehow like lifestyle changes can affect the disease enough that maybe they can come off the medication. So we also still want to teach her about the lifestyle changes because ultimately it'd be great if she could get off some of her meds. But for now, the answer is that she needs to stay on them, number 3. Question number 2. A 57-year-old client with a history of asthma is prescribed metoprolol, which is Lopressor, to control hypertension. Before administering the metoprolol, which of the following actions should the nurse take first? Is it number 1, to check the patient's blood pressure before giving? Number 2, make sure the patient knows about the side effects of the medication? Number 3, question the physician about the order? Or number 4, monitor for dizziness and hypotension post-administration? And the answer here is number 3. In the question, it says they have asthma, and this is a beta blocker, and then it's also saying before administering, what should I do? And before administering, I should call that doctor because I need to remember that beta blockers should not be given to asthmatics. If you can remember, they kind of block the lungs from being able to open, so we don't want to give that to them, definitely. And therefore, number 3 is the answer. So if you thought about numbers 1 and 2, those would be correct if it was an okay medication to give to the patient, but it's not. And then also, number 4 says post-administration. The question clearly said before administering, so just be careful there too. It's a good idea to make sure you definitely know the dangers and duties associated with your cardiac medications. The dangers are the side effects, the duties are your nursing duties and considerations. There is another video that goes in depth on the cardiac medications and it will be linked at the end of this one. So you can look at that if you want to. Question number 3. A client is started on first-line diuretic treatment with hydrochlorothiazide for newly diagnosed stage 1 hypertension. The patient knows nothing about the medication. Which of the following instructions should the nurse provide? Select all that apply. Would you say to them, number 1, eat foods high in potassium? Number 2, if you start feeling muscle cramps or palpitations, call the doctor. Number 3, do not eat potatoes. Number 4, avoid salt substitutes like Mrs. Dash. And the answers here are number 1 and 2. So in the question, it wants to know about hydrochlorothiazide. And in order to get this right, you have to remember content-wise that this is a potassium wasting diuretic. And so the dangers of being on the medication would be things like hypotension, fluid volume deficit, dehydration, and low potassium levels. And some of the nursing duties would be to teach them about eating potassium-rich foods because this medication causes hypokalemia. So number 1 is correct, true. Eat foods high in potassium. Number 2 is true. That is a side effect of possible potassium issues. Number 3 is false because we do want them to eat potatoes. Potatoes are loaded with potassium. That would be a great food for them to eat right now. And number 4 is false as well because we do want them to use the salt substitute because they have hypertension. And Mrs. Dash is actually a potassium salt, so that's perfect for them. So numbers 1 and 2, again, knowing the dangers and duties of your medications are where a lot of your nursing questions lie. Also knowing which foods contain potassium is important here. Potatoes, avocados, bananas, tomatoes, orange juice, beets, spinach, kale. If you do look at the cardiac medication video, there is a slide with all the potassium foods too. And also don't forget that salt substitutes are potassium based. So I have a question here. Which diuretic therefore cannot use salt substitutes? Do you guys remember the diuretic that actually raises potassium, which is spironolactone? They would actually not be able to use salt substitutes because of that. Number 4. A 50-year-old male patient with hypertension and smoking history is started on a direct-acting vasodilator isosorbide. The nurse knows important teaching about this medication is select all that apply. Is the answer number 1, this medication can cause an increased heart rate? Number 2, this medication can cause dizziness due to dehydration. Make sure to hydrate. Number 3, this medication is contraindicated in those with coronary artery disease. Number 4, if you use medications for erectile dysfunction, you can't take those when taking this medication. And the answer here is number 1 and 4. This is a content question about isosorbide, a direct-acting vasodilator. It is also asking about the most important. It's always most important to teach your patients according to Maslow, who says physical fatal is most important when it's appropriate. And in this case, there is definitely some physical side effects that the patient should know about. Side effects like hypotension and fast heart rate, dizziness, lightheadedness, fainting when rising fast. Headache could mean it's not working. And then yes, do not take the medication with medications for erectile dysfunction. They combined can cause a dangerous drop in blood pressure and angina to the point that if there's an anginal episode, they would need to call 911. So if we true-false this, number 1 is true. It does cause a reflex tachycardia. Number 2 is false. It doesn't cause dizziness due to dehydration. The dizziness is due to vasodilation. Number 3 is false. In fact, this medication is great for those with coronary artery disease. It opens up those arteries. And number 4 is true. We have to make sure that he's not taking this medication with medications like Viagra, Cialis for erectile dysfunction. And therefore, again, it's important to make sure you know the dangers and duties of any medications that you are studying. Last question, number 5. A client with newly diagnosed with hypertension is being discharged from the hospital on an ACE inhibitor, lisinopril. What is the most important information the nurse should give the client at discharge? Is it number 1, you may get dehydrated on this medication, make sure to hydrate. Number 2, this medication can cause high potassium, do not eat potatoes, bananas, or use salt substitutes. Number 3, you may get a dry cough. Number 4, if you feel a slight tickle or swelling in your throat, that is normal and will go away over time. And the answer here is number 2. In the question, it's about the lisinopril ACE inhibitor. And again, what is most important, as we just mentioned before, most important according to Maslow is anything that involves a physical fatal condition or problem. So the dangers of being on this drug is increased potassium levels in the blood, hyperkalemia, also dizziness from blood pressure going too low, and hypotension, angioedema, which is that throat swelling, and the headaches. And so we need to make sure that they know to stay away from the potassium foods and the salt substitutes because salt substitutes are potassium based. And therefore, that is why number 2 is your answer. Number 3 is a side effect. And if that caught you, that's okay to tell them, but it's not most important. Just because somebody gets a dry cough doesn't mean it's going to hurt them or harm them. And number 4, if they do feel that slight tickle or swelling in their throat, that is not normal. That's a sign of angioedema, which can be life-threatening. Remember, it's like under the skin hives, and they need to let their doctor know because angioedema can turn into a bad situation. So therefore, the further learning, as I mentioned, some side effects like loss of taste, fatigue, dry cough are not as dangerous and not most important. Always go after the ones that you know could cause a fatality possibly in your patient when you get those most important questions. Hope you enjoyed this video on hypertensive or antihypertensive medications, critically thinking and learning through the questions. If you liked this video, there's more like this on our channel, so please subscribe. Also, don't forget to like this video, and you can find us at signstrategies.com.